is April Fool's Day, but we don't want you to be fooled by common misconceptions about your health any day of the year. So Dr. Phillip Dixon with Cone Health Reidsville Primary Care is here to debunk some common health myths to help us all along on our health and wellness journey. All right, so we're going to tackle it one by one. Myth number one, you only need a primary care provider when you're sick or you have a chronic condition.
Not true, Tanya. We certainly see plenty of sick patients, patients with chronic medical conditions, but I think just as equally important part of our job is seeing patients that just need a partner on their wellness journeys, patients that just want to stay up to date on health screenings. So I think just in general, patients at all ages, all stages of life need a primary care provider. And that could be just an annual checkup to make sure that you're up to date on your vaccinations or age-appropriate cancer screenings, or you just want to have a conversation about strategies to work on things like weight loss. So no, we're here for everyone, not just those that are sick or with chronic conditions.
Yeah, you hate to go to the doctor only when you're sick. You want to go there to hopefully prevent something from happening to you, right?
Absolutely.
All right, so if someone doesn't have a primary care provider or may be new to the area, they're looking for one, how do they get set up with one? Because so often you're hearing, oh, we don't take new patients.
Great question. So Cone Health makes it really easy. If you just go to conehealth.com, right in the middle of the screen, you're going to see a big button that says make an appointment. And you can filter that search to your area, look at different practice options, different provider options, and schedule an appointment right away.
Okay, so here's myth number two. The myth is if I can't get to a doctor's office, I'm just out of options. And that happens often during flu season, allergy season.
Absolutely, and sometimes in those cases, we don't want you to come in the office necessarily because we don't want those diseases to be spread to other patients. So to that point, we really strive to meet patients where they are. Telemedicine is a growing entity, and I see patients virtually multiple times a day. I had 3 today, for an example. We really, and that could be like for a young mother that has young children that she doesn't necessarily want to bring into a doctor's office. We can address her concerns through a video visit. Cone Health also has mobile health clinics that are throughout the community. You can find a schedule when those mobile clinics are going to be in your community at conehealth.com. So no, absolutely you can see a provider without just coming into a doctor's office.
Which is fantastic when you don't have to get out of your pajamas to talk to the doctor, and you get whatever you need, and then you can, then go back and take a nap, and all of it is taken care of without even going. All right, myth number 3. Heart disease doesn't run in my family, so I don't really need to be concerned about my heart health. Why is that a myth?
Well, 80% of heart disease is actually preventable. It has nothing to do with your genetics. And really, to that point, you have to focus on your cardiovascular risk factors, and those are modifiable things like, if you smoke cigarettes, quit smoking. If you're overweight, if you're obese, working on weight loss. If you have hypertension, high blood pressure, making sure that's under control. If you're a diabetic, making sure your diabetes is under good control. So it's really doing things that you can to prevent ever having something like a stroke, heart attack, thing of that nature. So while your family history can contribute to your risk of a heart attack, a large part of it has to do with other risk factors and not just your family history.
What you eat, whether you exercise or not, all of those kinds of things. Okay, so myth number 4, exercise has to be at high intensity to get any kind of health benefit.
Not true. There is a committee that provides national guidelines for exercise, and they recommend at least 150 minutes, between 150 and 300 minutes of moderate intensity exercise on a weekly basis. What does moderate intensity mean? Examples they provide are things like a brisk walk, fast dancing. I generally just say something that gets your heart rate up. And to that point, I also say, I don't necessarily care what you do. I just care that you're doing something. They also recommend at least 2 days a week of strength training. So things like light weights, because that can be beneficial to your health as well. So you do not just have to go out and run 3 miles in order to get benefits to your health. That's what I often tell people, because people are like, well, I've got, arthritis. I can't go out and run. I can't go out and walk. Get in a pool. That takes a lot of stress off your joints. If you like to dance, I have one patient that goes to line dancing classes every week. That's a great way to exercise. It doesn't have to just be, again, running or something that's high intensity, if you will.
A lot of people think for aches and pains, it's better to wait and see if it gets a little bit better before seeking appropriate care. Why is that a myth?
Well, there are certain symptoms that you should ignore or delay seeking care for. Chest pain, for example, acute onset shortness of breath. If you have any numbness or weakness in your arms or your legs, facial droop, any acute changes to your vision, those could represent things like a stroke, a heart attack, even a blood clot in your lungs, a pulmonary embolism. And at that point, the adage is time is tissue. And so delaying care could result in a worse outcome for you. Now, certainly if you have a sore muscle or something and you want to give it a couple days, sure, but don't ignore those big symptoms. And my general thought is if it's interfering your quality of life, seek care. That's what we're here for.
Gotcha. Okay. Another myth, if you're not having any symptoms, you probably don't need to worry about any kind of cancer screening.
I hear this one a lot, and I can't stress enough the importance of early detection. For me in primary care, the cancer screenings I discuss most often are colon cancer, breast cancer, and lung cancer. And for those three types of cancer specifically, oftentimes if you're having symptoms, it could represent that there is something going on that's in an advanced stage, and it's much more difficult to treat. It's a lot more treatable, a lot more preventable to a degree if you are staying up to date on those screening guidelines. So going back to one of the first myths about if I'm feeling fine, I don't have any symptoms, I don't need a primary care doctor. Again, that's part of what we're here for, is to make sure that you're staying up to date with those age-appropriate cancer screenings.
Yeah, and that definitely hits close to home here at WFMY News 2. Our own Julie Luck got a preventative colonoscopy and found out that she had colon cancer. And so thankfully it was found early. We were able to take care of it, and she is a cancer survivor. So we get that here for sure. All right, another myth, food packaging that says all natural, low fat, organic. Those have to be healthy options.
You would think. I think there's a couple important things to remember about the food marketing industry. Number one, they're trying to sell more of their product. And in order to do so, oftentimes they are going for the minimum requirements as it relates to food labeling. So you mentioned all natural. That doesn't necessarily mean anything from an FDA standpoint. It's put on there to make people assume that their products are free of certain chemicals, things like that, but it really doesn't mean anything. To that same respect, low carb or light options, there's not really a defined meaning for those terms, and so you could put them on virtually everything. There are certain terms that do have stricter guidelines, like gluten-free, for example. The same with low fat. It does have a minimum or a maximum fat content requirement. Organic is another claim that we see a lot. That restriction is related to certain pesticides or chemicals they can put on the food, but it doesn't necessarily equate that the product overall is healthier for you. So you certainly have to not trust everything that you read on food labels.
For sure. Okay. Some people also believe that vaccines are just for kids, that once you get to be an adult, you don't need a vaccine anymore. Why is that false?
Well, there are vaccine guidelines that are for patients well into their 70s, 80s. Things like pneumonia vaccines, RSV, the shingles vaccine. We give patients flu vaccines every year at all ages, so it's not just children that need vaccinations routinely. There are plenty of vaccines that are indicated for adults as well.
Mm-hmm. All right, we've got about like 30-ish seconds or so. Final thoughts on what we should not be fooled about when it comes to our health?
Well, I think in general, just view wellness as more of a destination, not a destination, but more of a lifestyle. You can't expect to make just several changes at once and make it sustainable. It's something you need to gradually chip away at. If you want to focus on exercise and then work on your diet, that's fine. It's a gradual process and something you have to continually work on. And that's what we're here for in primary care.
Yeah, lifestyle, not just for a short amount of time to fit into some kind of outfit or whatever.
That's right.
All right. We thank you for your time and your expertise. We appreciate this. If you missed any of this, maybe you want to send it to a friend. It's going to be in the To Your Wellbeing section of our website.